Can seem like a subject that requires a lot of memorization, but hopefully by the end of this lecture we will see that the renal system is very practically organized. And this organization allows for the kidneys to perform their ultimate function, which is to do what? To conserve water while eliminating wastes in land-dwelling animals like humans. But in order to appreciate their ultimate function, we will first need to study the kidneys at both the microscopic and macroscopic levels. So, now let's flow on down to renal anatomy. I hope you're getting my urine analogy. At the gross anatomical level, the kidneys are retroperitoneal organs, located at the level of which vertebrae, let me ask you? The answer is T12 through L3. And that's on the left side. On the right side, the kidneys are slightly lower due to the liver. They receive blood from the renal arteries, which branch from the abdominal aorta at the L1 level. Renal arteries, L1. And they drain venous blood through the renal veins to the inferior vena cava. Now keep in mind that the renal veins pass in front of the renal arteries and aorta. There are two important points about the renal veins. The first is that the left renal vein, the left, is longer than the right. And that is why the left is chosen for living donor transplantation. So why is the left renal vein longer? Because the inferior vena cava lies to the right of the aorta, so the left renal vein has to travel a greater distance. The second thing to keep in mind about the renal veins is that the left gonadal vein, seen here, drains into the left renal vein, and then the left renal vein drains into the IVC. Whereas on the right side, the right gonadal vein drains directly into the IVC. So, due to the right angle at which the left gonadal vein drains into the left renal vein, and also because of its slightly longer length, the pressure inside the left gonadal vein is higher than in the right gonadal vein. As a result, testicular varicoceles are more common on the left than in the right. Now, do you remember what a varicocele is? A varicocele is an enlargement of the pampiniform plexus of veins found in the spermatic cord of the scrotum. This can be a very painful condition and can reduce fertility because sperm production requires a controlled temperature environment, which is controlled by the blood flow in the scrotum. Another part of renal anatomy involves its sensory innervation. The kidneys send sensory information to the spinal cord at the T10 and T11 levels. T10 and T11. So, pain in the kidney is commonly sensed in the T10 and T11 dermatomes. And on a physical exam, one can elicit pain at the costovertebral angles. On the test, CVA tenderness is often a huge clue that will point you towards the kidney as the culprit for the patient's symptoms. Flash quiz. Why is the left kidney rather than the right one harvested for transplantation? Answer. Because the left kidney has a longer renal vein. Remember that the IVC lies to the right of the aorta, so the left renal vein will be longer. On cross-section, the kidney is split into the cortex, here's the cortex, the medulla, seen here, so this would be the medulla, and the collecting system, which will start here and will end at the urethra, collecting system. Each of these areas has a separate function, which we will talk about in later talks. The medulla consists of the renal pyramids and columns. So this is a pyramid, and in between this area here is a renal column. While the renal cortex consists of the parenchyma above the medulla. Think of it like an orange, where the fruit inside is the medulla and the orange peel is the cortex. The collecting system, on the other hand, begins as the minor calyces. So this is a minor calyx. Each renal pyramid drains into its own minor calyx via a renal papilla, seen here. This diagram is actually a little off. The renal papilla is actually that tip of the renal pyramid there, not this area. The minor calyces then coalesce to form major calyces. So this would be a major calyx. The renal pelvis is then what the major calyces drain into, and it is pointed out here. The renal pelvis then drains into the ureter, which goes to the bladder. And finally, the bladder drains into the urethra, which has two sphincters, an internal, which is voluntary or involuntary? Involuntary, so it's under autonomic control, and an external sphincter, which is under voluntary or somatic control. Now, the vascular system of the kidney begins as the renal artery, which then branches into segmental arteries. These then branch into lobar arteries. The lobar arteries then branch into interlobar arteries. As the interlobar arteries arch over the renal pyramids, like here, they become known as the arcuate arteries. These then become the interlobular arteries as they branch further. And finally, the interlobular arteries will give off branches known as the afferent arterioles, and this leads us into microscopic anatomy. So let's say this is the afferent artery, and this is the efferent. The way that I remember afferent versus efferent is that afferent, the A is for arriving, and efferent, the E is for exiting. So the afferent arteriole is bringing blood or arriving at a tuft of capillaries called the glomerulus. This is where the filtration of the blood occurs. Plasma from the blood is filtered into the beginning of the nephron called Bowman's space. From here, the plasma is now called filtrate, and the filtrate passes into the proximal convoluted tubule, PCT. Then it continues on to the loop of Henle, shown here, and then it continues on to the distal convoluted tubule, and then finally to the collecting duct. The collecting duct will drain into the minor calyx at the tip of the renal pyramid, which is called what? The renal papilla. And we'll talk about each of these sections of the nephron in more detail during renal physiology. One last point to keep in mind is that the efferent arteriole continues on to form a network of capillaries known as the peritubular capillaries. Peritubular meaning around the tubules. Now, what will be the function of these capillaries? These capillaries will reabsorb the filtrate, unlike the glomerular capillaries, which do what? They filter the plasma. To finish up this section, we're going to continue our flow down the ureters. The ureters are retroperitoneal and thus pass underneath the uterine artery or vas deferens on each side in their course to the bladder. Of course, uterine artery in females and vas deferens in males. Now, the way that I remember this path is with the following. Water under the bridge. Meaning, the ureters carrying the water, or in this case urine, flow under the bridge, in this case the uterine artery or vas deferens. This plays an important role in surgery of this area, so this fact tends to be high yield on exams. During gynecological procedures involving ligation of the uterine vessels, the ureters can become damaged, and this can lead to urinary obstruction and postrenal azotemia, something we'll discuss more when we study renal failure. Another anatomical fact that can be tested is the arterial supply of the ureters. It's worth knowing that the upper third of the ureters are supplied by the renal artery, and the lower third is supplied by the gonadal and vesical arteries. Okay, so now let's finish with a flash quiz and a USMLE style question. List the following structures in the order that filtrate from Bowman space flows through them. The answer is first the proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule, and finally the collecting duct. Remember that proximal means near and distal means far, and that all nephrons ultimately drain into collecting ducts. And the loop of Henle is the loop between the two convoluted tubules, so this should help keep everything straight. A 2-month-old boy is brought to the physician after his parents palpated an abdominal mass while bathing him. They deny any fevers, chills, decreased urine output, or hematuria. A large mass is palpated in the midline. Abdominal ultrasound shows pelvic kidneys fused at their lower poles and not in their usual anatomic positions. Which structure prevents his abnormal kidney from occupying its appropriate position? The correct answer is B. Now let's see why. This patient has a horseshoe kidney, which forms when the inferior poles of the two kidneys fuse during development. As the kidneys ascend from the pelvis, they encounter the inferior mesenteric artery, and therefore they cannot rise to the normal level in the abdomen. Patients are usually asymptomatic, but they do have an increased risk of bowel obstruction, renal infection, and renal stones. Now, A and C are not correct because the aorta and inferior vena cava run parallel to the migration path of the ascending kidney, so they wouldn't be able to block it. And D and E are not correct because the intestinal arteries come off the superior mesenteric artery, which is above the inferior mesenteric artery. So, that wasn't so bad. Now it's time to replenish your extracellular fluid compartment because we have renal physiology coming up next.